It's now time to take our subjective and objective data that has been collected and to make an assessment. The doctor's responsibility is to assign a caries risk levels 1 through 4 based on the CRT results, based on his clinical judgment using the tracking sheet data and historical risk factors, and the decision-making flowchart. Caries risk assessment. Level 1 is the inactive, there's no disease. There's no caries process and there's no cavities. Level 2 is post-manifest disease. No caries process with cavities. Level 3, pre-manifest disease. A positive caries process activity going on and there are no cavities. Level 4 is a manifested disease. Caries process is present and there are cavities. Caries risk levels 1 and 2. Level 1 is anticipatory guidance. This is what we want to do. This is what you want to think about when you're providing caries risk. Level 1, inactive, no disease, no caries, no cavities. As a practitioner, we want to anticipate what we might need to do for this patient in home care procedures and regular dental checkups. 2, post-manifest disease, no caries, but there are cavities. Maintain suppression of the caries process and restore the lesions that are present. Level 3, pre-manifest disease. The caries process is present, but there aren't any cavities. With the caries process present, you can anticipate that the cavities are to follow. So we want to arrest the caries process prior to cavitation. Level 4, manifest disease. Both the caries process and the cavities are present. We want to arrest and restore by caries removal, mutans, cultures, anticipatory guidance, counseling and instruction, and restoration, or whatever else you as the practitioner deem necessary for that particular patient at that particular time. Caries activity and caries risk provide a diagnosis and a prognosis leading to a treatment plan by Steven Steinberg. This is what we've been talking about the whole time. The evidence now has been gathered. We have the subjective data from the patient, the caries risk test, or the caries assessment test, or other, our objective data tracking sheet, and our assessment. We got that information from the tracking sheet.